Hello everyone, this is Dr. Sangeeta Chaudhary once again. I welcome everyone to my channel. Today I am going to discuss about murmurs. I'll discuss about the points which we should look for in a patient if we get a murmur and how do we describe murmur when presenting a case. I'll also talk about the grading of murmur. How do we grade murmurs? I'll also discuss that whether a murmur is pathological or is it a functional murmur, right? Now, coming to the points which we should describe and discuss when we talk about murmurs. First of all, the site, okay, the location of the murmur, where the murmur is audible. And we need to find out which is the area where the murmur is best heard, okay, or we can say loudest, okay, over the precordium. So, the first thing is location. Next thing, timing. Timing means is it a systolic murmur or is it a diastolic murmur? Next, if it is a systolic murmur, is it a pentasystolic murmur? Is it a late systolic murmur? Okay, or is it an ejection systolic murmur? Okay. Now again, if it is a diastolic murmur, is it a mid diastolic murmur or is it an early diastolic murmur? Okay, so these we have to identify and describe. The next thing, character of the murmur. Okay, different murmurs have different characters. Like character can be rough, it can be rumbling, it can be musical, it can be harsh. So these are certain characters of different murmurs. Just for example, I'll tell you, if it is a case of mitral stenosis, the character of the murmur of mitral stenosis is typically rough rumbling in nature. So rough rumbling is the character of the murmur of mitral stenosis, mid-diastolic murmur of mitral stenosis. Okay, so this is about character. Next comes the intensity of the murmur. How do we describe the intensity? We describe the intensity in terms of grading of the murmur. So I'll discuss about the grading later on, right? So fourth point is intensity of the murmur described in terms of grading. Next point, fifth point. Next point is whether there is any radiation of the murmur or not. Murmurs can be radiated to axilla, they can be radiated to the base of the heart, they can be radiated to the carotids. Depending on the radiation also, we can identify which murmur it is and is it originating from mitral valve or aortic valve, all those we can identify. So we talk about radiation. Okay. Next thing, is the murmur is best heard with bell of the stethoscope or the diaphragm of the stethoscope. Lower frequency murmur are best heard with the bell of the stethoscope. Okay, so again this is also important. Next thing, the murmur is best heard in which position of the patient. Now suppose if the murmur is best heard when the patient lies on the left lateral position, then it is originating from the mitral region. Okay, if the murmur is best heard when the patient sits and lean forwards, then it is mostly originating from the base of the heart. That means either from the aortic valve or from the pulmonary valve, right? And lastly, we talk about dynamic auscultation. Now, what is dynamic auscultation? We will do different maneuvers and we will auscultate the heart for if there is any intensification of the murmur or the murmur decreases or not, we will see. That is known as the dynamic auscultation. For example, we will ask the patient to take deep inspiration. Okay, while taking deep inspiration or at the end of inspiration, we will ask the patient to hold the breath and we will look for any change in the murmur. So just to remember that all right-sided murmur, it increases with inspiration, whereas all left-sided murmurs, it increases with expiration. The only exception is being pulmonary ejection click, right? Okay, then this is one of the dynamic auscultations. Okay, we'll see with inspiration or with expiration if the murmur changes its intensity or not. Okay, other than this, we can ask the patient to do hand grip. We can ask the patient to raise the leg Okay, so there are different maneuvers, Valsalva maneuvers. We can ask the patient to do Valsalva and we will auscultate simultaneously and see if there is any change in the murmur quality or intensity. Okay, so these are the points by which we need to describe a murmur. Okay, so just for a quick revision, first one is the location, second one is the timing, okay, then third one is the character, fourth is the intensity, fifth is radiation, sixth whether it is best heard with bell or diaphragm of the stethoscope, seven whether it is best heard in left lateral position or sitting in bending forward position. Okay, lastly, the last point is dynamic auscultation, any changes in the murmur with dynamic auscultation. So these are the points which we should be describing while describing a murmur, while presenting a case. Now coming to the grading of murmur. Okay, the fourth point in murmur description was intensity of the murmur. So by grading the murmur, we will know how is the intensity. Okay, so murmur has 6 grading. First grade, very faint murmur, faintest murmur, which is difficult to hear, which is only audible in a very quiet room where both the patient and the clinician both are, in a relaxed state. Okay, so it requires clinical expertise. Next, grade 2, the murmur is soft but it is easily audible. Grade 3, murmur is loud but without thrill. Grade 4, the murmur is very loud with thrill, means very loud murmur which is palpable. Okay, palpable murmur is thrill. Grade 5, very loud murmur and which is audible even when the stethoscope is partly off the chest wall. Grade 6, murmur is audible even without the stethoscope. So these are 6 gradings of murmur. Okay, most of the functional murmur, they are of grade 1 or 2. Okay, and just to remember that the diastolic murmurs are never beyond grade 4. Okay, they are limited up to grade 4. So this is about the grading of the murmur. Grading will give us the idea of intensity of the murmur. Okay, lastly, how to know if the murmur is pathologic or it is a functional or innocent murmur. Okay, first of all, any diastolic murmur is pathologic. During the diastole of the cardiac cycle, there should not be any sound, okay, any extra sound. So any murmur which is present during diastole, it is pathologic. Any murmur which is pentasystolic or late systolic, it is pathologic. Any murmur which is continuous, that is again pathologic. Okay, that means any murmur which reaches up to S2, where there should have been a silence, but if the murmur reaches up to S2, it is usually pathologic. Any murmur whose grade is beyond 4, okay, 4 or beyond, right? That means murmur with thrill or beyond, it is always pathological. Lastly, if there is any cardiac, any valvular disease or structural heart disease, these are associated with the murmur, then most likely the murmur is pathologic, not functional. Okay, so these are the characters with which we will know if the murmur is pathologic or is it an innocent or functional murmur. Okay, now how to identify, lastly, how to identify the origin of the murmur. Suppose we are hearing a murmur. Murmur is nothing but the turbulence of blood flow. Turbulent blood flow results in a particular sound that is known as the murmur. So how do we know the murmur is originating from which area or which valve? Is it from mitral? Is it from tricuspid? Is it from aortic or pulmonary? Okay, so most importantly, the murmur where it is best heard is the site of origin most of the time. Okay, suppose you are hearing a murmur and it is best heard in the mitral region, so most probably it is originating from the mitral valve, not from the aortic or pulmonary or tricuspid, right? Okay, one more thing, if you are confused Okay, if the murmur is originating from the right side or from the left side, if you're confused if the murmur is originating from the mitral valve or tricuspid valve, you will do dynamic auscultation. If the intensity of the murmur increases during inspiration, then it is originating from the tricuspid, right? If the intensity of the murmur or increases during expiration, then it is originating from the left side of the heart, that is from the mitral valve. Okay, this is how you localize or fix the like origin of the murmur, from where the murmur is getting originated. Okay, so this was a small discussion about murmur. In my upcoming classes, I'll discuss about the different types of murmurs: systolic murmur, diastolic murmurs, how do they sound, all those things. Thank you so much for hearing the class. I hope it will be helpful for you all. Thank you.